How does panleukopenia start? Figuring out how panleukopenia actually starts is one of those things that really helps me understand why it's such a dangerous disease for cats, especially kittens. So let's talk about that for a minute. How this virus even gets into a cat's system and begins to cause all that damage. First off, panleukopenia is caused by the feline parvovirus, which is incredibly contagious and super resilient. This virus is found pretty much everywhere once it's shed by an infected cat, like in their saliva, urine, feces, vomit, and even in their nasal secretions. It's kind of mind-blowing how easily it can spread, and it can stick around in the environment for months or even a year, just waiting to infect another cat. So even if you think everything looks clean, the virus could still be hanging out on food bowls, bedding, litter boxes, or even your shoes and clothes if you've been around an infected cat. Now, the way it usually starts is that a cat comes into contact with the virus, maybe through direct contact with an infected cat, or by sniffing around in a contaminated area. Once the virus enters the cat's body, it goes straight to work. It likes to attack rapidly dividing cells, and it's really good at it. The virus first heads to the lymphoid tissue, like the tonsils, and starts replicating like crazy. From there, it gets into the bloodstream, which is when things get serious. After it's in the bloodstream, the virus spreads throughout the body, targeting the bone marrow, intestines, and even the developing fetus if the cat is pregnant. This is where the real damage begins. In the bone marrow, the virus attacks the white blood cells that are supposed to fight off infections. That's why it's called panleukopenia, because pan means all, and leukopenia means a decrease in white blood cells. With the immune system compromised, the cat can't fight off the virus, or any other infections that come along, for that matter. In the intestines, the virus destroys the cells lining the gut, leading to severe vomiting and diarrhea, often with blood, and that can cause rapid dehydration, which is really dangerous, especially for kittens. That's why the disease seems to come on so fast, and why it can be fatal if it's not treated right away. The incubation period, the time between exposure and the start of symptoms, is usually 3 to 7 days. During that time, the cat might not show any signs at all, which is scary because they can be shedding the virus and infecting other cats even before they look sick. So in a nutshell, panleukopenia starts with the cat coming into contact with the virus, either directly or indirectly, and then the virus goes to work on the immune system and gut. It's a brutal disease, but the good news is that it's preventable with vaccination, which is why getting your cat vaccinated is so important.